Hi, I'm Tina Howarth, massage therapist at Academy Massage Therapy. If you've ever suffered from abdominal discomfort such as tummy pain, cramping, bloating, constipation, flatulence, well, then this wellness segment is for you. Today I'll be talking about digestion and the role that massage plays in supporting healthy digestion and elimination. I'm going to tell you right up front that yes, I will be talking about bowel movements. So if you're all set, let's get going. So everybody at some point has experienced abdominal discomfort. Naturally, we would turn often to observation first. Maybe did I eat something bad? Did somebody else eat the same thing? And do they feel the same way? Sometimes we will try and cut stuff out of our diet like sugar and yeasts and gluten or certain foods that we think might be irritating our stomach. Other people might try to add things into the diet to help, like a probiotic, fruits and vegetables for fiber. Those are all good. But still, discomfort happens. Sometimes it's just occasional for some people, but for other people it can become a chronic, difficult condition that they deal with a lot. For example, irritable bowel syndrome, Crohn's and colitis, celiac disease. Those are all inflammatory conditions of the digestive system, and massage is a great tool that you can actually provide a lot of relief for that. Also, I want to bring up the fact that the inflammatory conditions of the abdomen have a very strong link to our emotional self. And I'll explain that a little bit in more detail in just a few moments. But our emotional self has a very big effect on the physical self, even to the point of changing our biochemistry a little bit. And also sometimes even the appearance of our skin is also very linked to that. So let's get started first by talking about how healthy digestion works. Okay, so a brief look at normal digestion. So it actually begins with when you put something in your mouth, hopefully something good and delicious. So your teeth are the first thing to break down the food, and then you add in a lot of water and enzymes that are present off the tongue and saliva, and then it goes down the throat, through the esophagus, and into the stomach. By the time it gets to the stomach, now we are churning everything and really mixing it up, and a lot of acids are added in here. So now you're mechanically breaking down the food and chemically breaking down the food. And then it continues traveling along into the small intestine, where all kinds of nutrients are absorbed from the food and into your blood and lymph. Then it keeps moving along into the large intestine, where further water is removed from the matter going through your gastrointestinal tract. I'm going to call that a GI tract from here on out, okay? And then also some vitamins are produced in the large intestine for you. And then finally, a nice, hopefully soft formed feces is formed to get rid of what your body didn't need. So then you're all set for elimination. So all of this well-timed and coordinated activity through the digestive system is governed by the autonomic nervous system, which means it happens whether you think about it or not. Now, the nervous system is found not just in the brain, but also as an extensive network of nervous system tissue that's actually found in the walls of the GI tract, and that's called the enteric nervous system. So now you can clearly see the link between the central nervous system and digestion, and why our emotions have a very real effect on digestion. So under the influence of stress, our digestion is actually inhibited or halted, okay? This is a very efficient thing to do if we are in danger, and it would be very inconvenient to stop to go to the bathroom there. But most of our modern day stress is not life-threatening. Yet the nervous system and digestion responds the same way. It suppresses digestion, leading to more time for the matter to move through the digestive tract, and meaning that more water is pulled out and absorbed into the body, leaving your stool harder. So constipation. this is a good place to talk about transit time, or what is normal time for you to go from eating to eliminating. So this is very, very, very general. Average is 24 to 48 hours after you've eaten. But there are lots of factors that influence this. Basically, the most important thing to remember is that if you have formed a stool that is soft and comfortable and easy to pass, then that's what counts. Not so much if it's just once or twice a week, or if it's once or twice a day. So really, it's about comfort. Okay. Let's talk a little bit about the factors that affect constipation or digestion, okay, transit time. So we have lifestyle things like poor diet, lack of exercise, resisting the urge to go because maybe there's not a good bathroom around, or it's not the very good time for you to go, so you hold it. Again, that causes constipation. Also, let's add some physical factors like poor muscle control of the muscles involved in elimination. Also, post-surgical side effects of constipation is very common. Certain medications also cause constipation. Pregnancy and early postpartum, constipation is very common. Also, sometimes there's actual things that inhibit elimination, like polyps and hemorrhoids. Some certain colon cancers and things will also affect elimination and make it uncomfortable. And then finally, we have the psychological effects, such factors such as depression, eating disorders, obsessive compulsive disorders regarding elimination, and addictions to laxatives or enemas. Those things will also affect elimination for you. So, how can massage help you? Well, first I want to talk about the general massage. So never underestimate the therapeutic benefit of a relaxation massage that supports a healthy nervous system and a calm and peaceful environment. A lot of things happen during a peaceful environment for your body, like digestion is one of them. Again, massage for relaxation, very good. Next is the specific massage that you can use when you have constipation. An abdominal massage can bring you lots of relief. First, it will loosen up the diaphragm and it will relieve a little bit of that abdominal congestion that happens. Second, it will help you move and push along the fecal matter, okay, through the GI tract. And third, a specific massage can also relax a lot of the muscles that maybe if you've been straining for a while already, they might be sore. So things like the low back, the glutes, the hip flexors and psoas, those muscles are all involved in elimination. So massage to those areas can really bring a lot of relief as well. So some things that you can do on your own to support healthy digestion are stay active. Exercise really helps keep things moving. A good diet with lots of fiber, fruit and vegetables. Also, you will want to do maybe hobbies that help keep the nervous system calm and relaxed and give you a good outlet for stress. And of course, lots of massage. So this pretty much wraps up today's health and wellness segment on digestion and how massage plays a role. I hope that the things that we've covered will help you in your quest to feel healthy. You can stay in touch with us via Facebook, Twitter, and our website. And thanks for spending a little bit of time with me. We'll see you soon.